Hi, and welcome to the Drug Frontline. This is the second of my videos introducing WHO medication safety toolkits. Most of these toolkits emanated from the third Global Patient Safety Challenge, Medication Without Harm. The toolkit I want to introduce today is called Know, Check, Ask. It speaks to both the healthcare professionals, that is the medical doctor, pharmacist, or a nurse, and it also speaks separately to the patient. So I'll handle the healthcare professional first. So the first thing is know. You as a medical doctor, as a pharmacist, as a nurse, you should know the medication you're about to give. Be familiar with it. Be familiar with its side effects, with its contraindications, and so on and so forth. The second one is to check. Do you have the right patient? Because sometimes we can make mistakes based on that. Do you have the right medicine? Because sometimes we have what we call look-alike and sound-alike medications. So you should ask yourself, is this the actual drug? The third thing is the route. You should make sure that this is the route you want to give that has been prescribed, oral or injectable. Sometimes we can make mistakes like that. And the third one, the timing, the regimen. This twice daily written here, is that the correct thing, or should it be once? Or should it be 3 times? And so on. And then finally, ask. If you are not sure, you can ask a colleague, or you can ask another healthcare professional. The pharmacist can ask the medical doctor, is this what you really intend? The medical doctor can ask, are there any contraindications with this? The nurse can ask. And then finally, you ask the patient, do you understand? If they say yes, that they understand, you can tell them to run it back to you. So that takes care of the healthcare professional. Now, the patient. Before you take it, you should know your medicines. And like I said in my first video, you should have an updated medicines list. But what I mentioned in my first video was that it should be handwritten. Yes, after it has been handwritten, including all your herbal medications if you take any, all your supplements if you take any. If you take green tea or black tea, it should be there, and we should know the brand that you're taking. Now, what we would like you to do is to snap it with your phone, and then you can share it with other family members so everybody knows what you take. And if it is changed at a doctor's visit, as a pharmacist visit, or whatever it is, you write a fresh one and resnap it, delete the old one. So that is know your medicines. The second one is check. Am I taking these medicines the right way? If you know the medicines, then you're already halfway to checking them. You know, the right dose, am I taking it at the right time? Am I taking the correct number of tablets? And if you are checking and you are not sure, what do? You go to the third one, you ask. You ask a healthcare professional. Never stop, reduce, or increase your medicines without first talking to a healthcare professional. And never share your medicines. Never. You should ask your pharmacist for what we call a patient information leaflet. If you buy a packet of tablets that will last, say, a month or 2 weeks or something like that, it will have a patient information leaflet with all the doses, the side effects, contraindications, all of them will be inside there. If the pharmacist says they don't have enough to go around and they've given this person, don't worry about it. Don't worry about it. Now you know the name of your drug. Pick up your phone, write down the drug, Google the name of the drug, says amlodipine for high blood pressure. Say amlodipine, patient information leaflet, add PDF file. Just add PDF at the back and Google it. You'll see tons of stuff. Download one onto your phone and then read everything there. So on your phone, you will have all the information you need on your medication. Everybody has a role to play in medication safety. Here at Drug Frontline, We want all of you to find taking of medicines to be as easy as using a smartphone, which you can now use if you find this useful, to like, subscribe, and to share. Thank you very much, and see you soon.